Welcome to today's webinar. The topic for today is Legionella in Senior Living, a positive case or test. Now what? My name is Megan Klein and I will facilitate our meeting. Please note, the information contained in this presentation is intended to provide general information but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. Please do not act upon this information without first consulting qualified counsel. Today's webinar will be presented by Bill Pearson and Jack Murphy. Bill is a certified water technologist with more than 40 years experience in the water treatment industry, specializing in Legionella and water pathogen risk management. Bill has written numerous publications covering various aspects of water treatment and Legionellosis, and is the primary author of the AWT Legionella document. He has contributed to numerous technical manuals, educational training, workshops, and seminars. Jack Murphy is an ASSE certified Legionella water and safety management specialist with expertise in the water treatment industry, specializing in Legionella and water pathogen risk management. He's a graduate of North Park University with a Bachelor of Science degree. Jack has become a recognized expert in water treatment and innovative technologies that reduce risks associated with Legionella bacterium, and has contributed and presented in numerous educational webinars and online training workshops. Thank you so much for joining us, and now please welcome Jack Murphy.
Good afternoon and welcome to our webinar, as Megan mentioned, titled Legionella in Senior Living, a positive case or test. Now what? So this is the latest installment of the Legionella in Senior Living series, where we focus on answering the question, what can we as senior living facilities do to protect residents and comply with the latest mandates and requirements concerning Legionnaire's disease? So just to take a look back, in the past during this series, we've learned about, Legionnaire's disease at a 101 and 201 level, how to comply with the various guidelines and standards such as ASHRAE 188, the CDC, Centers for Medicare and Medicaid Services, and the Joint Commission. And we've also focused on the components of water management plans to reduce the risk of Legionella to your residents and facilities. So in our session today, we're going to be taking the next step in talking about a time when you may have Legionella in your water system and what to do in the event of a case investigation. So in terms of learning objectives, what we want to do is give you the steps you'll need to take in the event of a positive test or case. And coming out of this session, you will better understand your role when it comes to these situations. And you'll be able to identify the essential and non-essential tasks in order to respond most efficiently. And last but not least, in terms of my section here, Megan gave a great background into who we are. But again, my name is Jack Murphy. Bill Pearson is joining us as well. Bill has deep experience and is one of the most respected water pathogen specialists in the country, and served as the vice chair of the ASHRAE 188 committee. And for those of you who may not be familiar with us at IWC, we're a full-line provider of Legionella and water treatment solutions, have been partnered with Direct Supply since 2017. We really value this partnership as it allows us to work with and educate many of you, and the integrations with the TELS platform make things seamless for water management program teams, allowing for the possibility of improved outcomes when it comes to Legionella. Now that we have this background, I'd like to turn it over to Bill to take us through the content.
Thank you, Jack, for the introduction. And it's my pleasure to be here to talk about one of my favorite subjects. As Jack mentioned, we've done in this series several for Direct Supply, and this one is of particular interest because it's answering an important question. What do you do once you're testing and you get positive results? Or what do you do, very importantly, when you have a case investigation? So let's do a quick refresher on Legionella. What is it? Hopefully the audience has been involved with Legionella to some extent. It's a very common bacterium found in our environment, aquatic bacterium. But more importantly, we commonly find it in our plumbing systems that are associated with our building systems, as well as some non-potable devices such as cooling towers, decorative fountains, and spas. So the bottom line is Legionnaire's disease, and this may be the last time I try and say Legionnaire's disease because I'd rather more correctly call it Legionella pneumonia. The Legionella bacterium causes a type of pneumonia, a very serious disease, and it can be fatal. So it's caused by one of the species, Legionella pneumophila. And pneumophila is Greek for lung-loving because that's where the bacterium sets up its infection of pneumonia. Occasionally, rarely, it's caused by other species of Legionella. So the disease cause and transmission, it's very important. I have some graphics on the left that are coming out of the CDC toolkit, and I will talk more about those toolkit resources from the CDC. But the transmission of Legionella pneumonia is upon exposure to fine mist or aerosols, water droplets containing Legionella. So this is an inhalation. These droplets are small enough, they're of respirable size, and this gives it a direct route into the lungs. Aspiration, a choking, is also another common pathway for transmission of the Legionella. Rarely, there are some others. I mentioned that here in the bottom, direct instillation into a patient. But by and large, we're going to be talking about the inhalation aspiration aspects of transmission of Legionella pneumonia. So exposure sources. Once we consider that aerosols, water fine mist, come from a wide variety of devices and systems that we're probably familiar with. Some maybe we're not so familiar with. So here you see everything from a shower head on the left to a hot tub and a humidifier, misters, water fountains. That ugly thing down at the bottom, that's an ice machine, and we'll be talking more about that. Then, of course, a cooling tower. So these are our exposure sources. But I like to make a note here. Just because Legionella bacteria happen to be around or in one of these devices, it does not mean necessarily that they're going to cause infection. There has to be a chain of events occur upon exposure, and you have to have a susceptible, what we call vulnerable host, to certainly express the pneumonia form of legionellosis. So to cause infection, though, they typically need to grow and multiply to higher levels in the building water systems and from the devices. Who is at risk? Immunocompromised individuals, transplant patients, diabetics, cancer treatment, smokers, chronic lung disease, COPD. This one always gets me, those greater than 50 years old. Sounds a lot like what we've been hearing during the last 2 years, the pandemic. It's the same vulnerable individuals that are most vulnerable to legionellosis. However, 1 in 4 cases, or 25% of Legionella pneumonia, does occur in otherwise healthy individuals, individuals that don't fit that profile. But of course, overwhelming is the 75% in our senior living. That's a very, very high number, prominent number. So where do outbreaks occur and happen? Just go over a quick couple. I think we've heard about the first one in 1976, a little while ago in Philadelphia at the Bellevue Stratford Hotel. This led to the discovery of the Legionella bacterium. And more recently, well, actually it's now 6 years ago, we had the very publicized outbreak in New York City in the Bronx. And I mentioned this one because it literally occurred right on top of ASSE publishing their long-awaited 10-year in development standard 188. But CDC outbreak investigations have taught us a lot more about Legionella and where outbreaks occur. This is a 14-year, 27 investigations, and we focus here on the healthcare. 57% of the cases were healthcare associated, and 85% of the deaths were, from a healthcare setting. So here again, we see our sources of Legionella. The outbreak in Philadelphia was attributed to a cooling tower, and the very prominent outbreak in New York City was also attributed to a cooling tower. And there's been this long-standing thought from actually many decades, from 76 on, till the paradigm shifted. But the Legionella bacteria is more commonly found in our potable water as a source of causing disease. So CDC says 50% potable water. Still prominent is cooling towers at 22%. Then we see some of the other sources, decorative fountains, hot tub spas. So we see them happening in our hospitals, but that's not the only place. Unfortunately, in Atlanta, we had a prominent hotel. And so really any big building, because they have complex water systems where the Legionella can find favorable conditions to grow. And then upon exposure through, again, production of aerosols and a susceptible host, we can get the disease. We see them on cruise ships. Even the Playboy Mansion had a well-publicized outbreak, not of Legionella pneumonia, but of the other Legionellosis, a milder form, Pontiac fever. Casinos have been hard hit with them. And again, hot tubs. And this was from actually my home state here in North Carolina. A couple of years ago, there was a hot tub display, part of a state fair in the western part, and caused a lot of illness. And unfortunately, 4 dead from contracting Legionella pneumonia. So where outbreaks happen, and our focus today is going to be in the senior living environment, including our veteran homes, where we have that vulnerable population, and we must assure that we can manage Legionella in those systems. So here's a tip. We'll be talking more about this later. Keep the water flowing. This is very important. And we have seen actually during this past year and a half or so with the pandemic, when we all sheltered in place and left the hotels and buildings, workplaces, that if there wasn't an effective water management plan or something to keep the water flowing, many times upon returning, we had conditions conducive to bacterial growth because the water stayed in there stagnant, lost disinfectant, no flow, low flow. So this is a very important aspect of management. So positive test results. Now what? Here we have a picture of a lab report down on the bottom. But we're going to first say that we need to have a water management plan in place. This is the vernacular of the ASSE Standard 188. CMS, the Centers for Medicaid and Medicare Services, as well as the Joint Commission, basically have mandated that healthcare facilities, long-term care, rehab, skilled nursing, any facility that is either accredited by the Joint Commission or by CMS to receive funding needs to have a water management plan in place. So testing, when you have a plan, the only way to validate that plan that you are controlling Legionella is to test for it. That's the only definitive way. However, testing is going to be something we're going to be really talking about here shortly. We should focus on the goal of the water management plan, which is validated with testing. The goal is to have 0 cases of disease. 0 or non-detectable Legionella via testing may not be obtainable. But the important thing is that we want to have 0 cases, and that's what the water management plan and testing should focus on. A positive test result is not necessarily a bad thing. It's an opportunity to tweak and look at the water management plan and see if we can better control Legionella. When we talk about testing, step one is interpreting the test results. And when we're talking about building or potable domestic water systems that we test, there's actually three aspects of the test that should be considered. One is what we call the distal site positivity. If you have a representative sampling of your facility or your building, we'll talk more about that in just a minute, an appropriate number that can represent the building, then it's very important. We have data that substantiates if the number of samples taken that test positive are greater than 30%, then that is a much higher risk of having disease, having Legionella pneumonia associated with that system. The concentration of the bacteria when the testing, which primarily right now is culture testing, it's cultured on a medium and it's measured in colony forming units per milliliter. So certainly the concentration is important. And the species, as I mentioned earlier, Legionella pneumophila is one of some 62 or 3 recognized species, but it is the major species causing the greatest amount of Legionella pneumonia. European data attributes 97% plus cases of Legionella pneumonia being caused by this one species, Legionella pneumophila. Now, pneumophila is broken down into some serogroups. That's why you see on this report, I think I've got it right here, a little bit larger. It's Legionella pneumophila serogroup 1. So this example test report, we have 4 samples that were submitted. One was from a hot water storage tank. 3 were outlets in resident rooms. 2 of them happened to be showers. 1 of them was a sink. Only 1 was positive. That sounds pretty good. That's less than 30%, 1 out of 4, but this would not be a representative sampling. This facility certainly was 60 rooms, maybe more, would have to have a lot more samples tested in order to be a representative sampling and to make any evaluation in terms of percent positivity. The colony forming units per milliliter, the concentration, in this case, it's 10. We'll be seeing some recommendations by the CDC in just a moment and the relevance of that number. Unfortunately, this detected Legionella on this sample testing is the main one, the one we red flagged, Legionella pneumophila serogroup 1. So once we've got our results and we're considering the things I just mentioned, the number of samples that are positive, and maybe if it's a representative sample, the percent positivity, we can apply that, as well as the concentration and the species. We want to analyze and assess our testing. Were there any errors in the sample collection, handling, and testing? And we would want to make sure that our equipment was in good working order. Now, very importantly, was the water management plan implemented as designed? That aspect, the ASHRAE standard 188 requirement is that your water management plan must be verified. Are you doing what you said you were going to do? Is it being implemented as designed? And as I said earlier, the aspect of testing is to validate the water management plan. Is it successfully managing or controlling Legionella? And we would also need to consider in this analysis some of the physical and chemical characteristics of the incoming water, events that may have contributed to maybe an infestation or a leakage of Legionella from the municipal water supply through pressure changes and main breaks, etc. We'll be talking about that. Response activities. This is sort of the now what. Well, you're going to want to reevaluate, your water management plan. This is the opportunity, as I said, to tweak it and maybe find that we need to do other aspects where maybe we're not flushing those infrequently used outlets or those unoccupied rooms. Some of these response activities will be to consider what type of remedial treatment is needed. It may be as simple as increasing the flushing program and resampling. But if we have a huge amount of samples, a greater than 30% positivity and high levels, we may be needing to do something a little more drastic, even addressing some of the actual outlets, the faucets or the shower heads, removing them, cleaning them, sanitizing them, maybe replacing them. Certainly that would be true for devices such as ice machines. And then we would then want to retest a set of representative samples. This is where we want to focus on. Let's get a better picture of the health of our building. We sent in 4 samples, 1 came back positive. We can't make any evaluations based on that. Let's go ahead and get the appropriate number of samples. And so that would be like step 3. As I mentioned,
hey, Bill.
Yes.
So if I get a positive test result back, one of the natural reactions that we hear a lot of times is, oh, I shut off this, and I closed down this entire area, this whole bathroom. You know, is that an appropriate response? You know, I know that's natural to, you know, limit that exposure there, but is closing off a wing or an area an acceptable approach?
Well, your water system, if it can't be isolated, closing off a wing is not going to keep any Legionella that's in the circulating water system, you know, from going elsewhere. In fact, when you say close off, or it would be important to know if you're talking about not keeping people out of that or having exposure there. But the idea that the water is circulating throughout the entire building, closing a wing down, if you're not going to address that area through flushing, then it would not be an appropriate response. Did that answer the question, Jack?
It did, yes. Yeah, I just, one of the things we see all the time is that if you get a positive case or a positive sample, you know, they'll close down a restroom or whatever, not get that water flowing. And, you know, as you mentioned earlier, it is pretty important to keep that water flowing through those fixtures.
Yeah, and that was my point. Maybe I didn't say it exactly as I wanted to. I was thinking about what you meant by closing down a wing or a section. You know, that's actually the last thing you want to do if you mean by closing down, stopping everything, not using those fixtures or anything else. You want to address the root cause, which may very well be you need to increase the use of those outlets if they are infrequently used. So flushing is going to be one of our first and actually easiest things to do with addressing positive results from your sampling. This here is something very important. If you're not familiar with the CDC toolkits, and they came out very quickly in 2016 and 2017, right after the outbreak in New York City, in support of the new ASHRAE Standard 188, they came out with toolkits that explain more about Legionellosis and water management plans, and they put a focus in 2017 on the healthcare industry and facilities. While overall, about 10% of Legionella pneumonia cases result in death. If they were acquired in a healthcare setting, that changes drastically to, according to the CDC data, 1 in 4 or 25%. So it is very important. But this is the latest, 2021, I believe it was right the very first of this year in January. The CDC came out with a really, really nice document for Legionella Control Toolkit. And for one of the first times, they discussed the aspect of testing and what is a controlled building water system, what is out of control, what is poorly controlled, and what is well controlled. And I like this approach. I think the industry has well received this. If you have equal or greater than 10 CFUs per milliliter, that's out of control. That is not acceptable in our potable water systems. Now, less than that, it's would be considered poorly controlled if you are under 10, but you are still greater than 1 CFU per milliliter. Well controlled, and this goes back to what we mentioned earlier, that you just may not be able to eliminate completely Legionella in your building water system. But if it's less than 1 CFU, at one point in time, that was the actual limit of detection, or it was actually 10. And let me mention this. We talk about 0. There's no such thing as 0 Legionella because our test methods have a limit of detection. And currently with culture, especially using a 1 liter sample, that limit of detection is around 0.1, or it's less than 1 CFU. So that would be well controlled if you had less than 1 CFU. It would be better well controlled if you had no Legionella detected in a single round of testing. And it would be best if you had no Legionella ever detected in multiple rounds of testing. And then this last thing gets into some stuff about testing other various types of testing where you can detect viable and non-viable bacteria in many species. That would represent the absolute best. So CDC, just Google CDC Legionella Toolkit. These are free downloads and should be a part of any water management plan, and certainly references for your facility. So now let's go into we've talked as much as we can. I'm trying to save a lot of time for Q&A, and I appreciate Jack bringing up that one question. Jack, if you have any more, go ahead and do it during this section, because this is the one that causes a lot of concern. I
do have one more, Bill. Before we move on, I do have one more question. Is it bad if I test positive for Legionella?
Well, everybody wants to say, I don't want any Legionella in my system. I test for it because I'm trying to see if I control it. But this goes back to, Jack, you would have to assess the number of samples that you detected Legionella, the concentration or level at which you detected the Legionella, and still practitioners, we consider the species important. When it's Legionella pneumophila, especially Legionella pneumophila serogroup 1, that gets all of our attention. If it's a non-pneumophila species, and there are some 60 plus of them, if it's Legionella anissa or some other obscure species that may not have ever been associated with disease, or very, very rarely under very severe immunocompromised circumstances. So it's something to act on. It doesn't mean you do nothing, but you put it in the frame of evaluating where it was, and the items I just mentioned, the species, the concentration, and the percent positivity. But you will want to have some type of response. If nothing else, you're certainly going to look back on your water management plan to see if you got all bases covered. So
perfect,
now we have a confirmed or probable case. You're going to hear about this generally from your local or state Department of Health, Public Health, because Legionella pneumonia, Legionnaire's disease, is a reportable disease. And the CDC tracks it in their national surveillance system. And we find out that in their preliminary investigations on diseases, they'll be determining if this person traveled anywhere, and they start connecting the dots, so to say. But you'll get this when you have a letter or a phone call, or maybe a knock on the door, but from the DOH saying that we have a case, one of your residents, patients, was recently diagnosed with Legionella pneumonia, and that sets off a lot of things in action. So case investigation, I don't want to scare anyone, but I'll kind of use this graphic here. Every time I go to the doctor, my doctor or nurse or somebody, with complaints, I have complaints, they say, what is your pain level? On a scale of 0 to 10, what is your pain? Well, a case investigation is going to cause pain, folks, and it's not no pain or mild or discomforting. I've just empirically put this together because I've been involved with so many. It's somewhere around very intense to severe and unbearable. So your pain, you need to be prepared. It's going to be a 7, 8, 9, or 10. And that's why this is such an important topic, and we want to better prepare you for what's going to happen and what you're responsible for. So what triggers an investigation? As I mentioned, it's going to be the reportable disease system, the contacting by the Department of Health, local or state, and one or more cases linked by time and location. That's actually an outbreak, but we're going to see these investigations started when you have one or more cases. The incubation period, once a person who has contracted the disease, once they've been exposed to it, they typically have the symptoms, and it's pneumonia. You're going to have fever, you're going to have myalgia, you're going to have a lot of symptoms, ultimately the rattling chest, indicative of pneumonia that can be diagnosed with x-rays, and the cough, as I said. So the incubation period is somewhere between 2 to 10 days. That now has been extended out to 14 days. The bulk of them is within the first 5 or 6 days after exposure. So this becomes important information to start an investigation, trying to find out where possibly did the patient, contract Legionella. Now, if they've been in your facility and have not left ever, then that's going to be very strong evidence that it's a facility acquired case. If they've been there for 2 weeks and didn't leave, have any other potential exposure, that's probably or most definitely going to be a health or facility acquired case. So these are the questions. Did the case spend time in or around the facility, in our senior living environment? Many times they're there, but maybe it's just an assisted living or independent living, and maybe they do travel. They go out into the community. Well, there's other sources of exposure. So this starts the investigation. The DOHs or health departments, they will ultimately confirm if your case meets the definitions that we're going to briefly mention here, and then if, when, and how an investigation will proceed. But this starts things, obviously, a reported case. Now, the CSTE, that's the Council of State and Territorial Epidemiologists. I hate throwing acronyms at you. We all know what the CDC is. But this Council of State and Territorial Epidemiologists, along with the CDC, they set these parameters, and these were recently updated. That 2 to 10 day exposure now has been brought out to 14 days, as I mentioned earlier. And that's due to the, this CSTE and CDC's updating. And all their other exposure categories, you'll have this presentation, so you'll be able to read this. I don't need to read every slide, but you'll be needing to talk about, is this a presumptive health care or a possible health care, assisted living, senior living? So we get these confirmed and suspect cases. These are CSTE, classifications. And we'll go into now what is going to ensue with an investigation. The first steps mentioned earlier with the graphic on the pain level, they can be highly stressful. So we do want to stay calm. You're going to want to get a team together. And this absolutely starts with the facility administrator and any stakeholders. You're going to involve infection prevention, and you need to consider public relations. And the DOH almost always recommends that you get a subject matter expert. In other words, you get a consultant, a Legionella consultant. So you're going to need to take time to understand all of these requirements and procedures. When the DOH is involved, we kind of all take our marching orders from them, but I like to more appropriately say we work with them. And it does vary from state to state. We deal with departments of health, public health, both local and state, across the United States. Some are very used to investigations, and some say, you need to get a consultant and, follow their recommendations. It can be that broad of a difference. You go to New York City, you go to New York State, because of their prevalence of dealing with, number one, that big major outbreak in 2015, but others, they have assessed a great deal of experience and data, and they're going to want to really rule the ship and tell you what you need to do and what they want to see, as the investigation proceeds. One thing you don't want to do, you should not remediate or perform any corrective actions before you do sample testing. Now, most of the facilities are doing testing in a proactive manner or to validate their water management plan. So when you've gotten positive results, or you get contacted by a DOH because of a case or probable case, they're going to want to get some testing done before you've drained the hot water system or the hot water tanks, or had the ice machine sanitized, or anything else, because we need to have that baseline information. But one thing they're going to absolutely do, and this is where the stress starts coming in and the pain starts coming in, and I am not at all being derogatory, it is their primary objective, the public health, departments of health, is to protect them. And so you're going to want to control exposure. If you've had your test and you've got, or even if you hadn't had testing yet, you've got that healthcare or facility acquired case, a confirmed case at your facility, they'll want to make sure that there is no exposure to any of the other residents or patients. So this is going to be the proverbial water restrictions are going to be put in place. No water usage for personal hygiene, that's showers and culinary or drinking. You'll be using bottled water. There'll be other aspects of the investigation. We can get into them here on this page. This is where the pain starts. Really, they're going to want to perform what we call retrospective review of cases in the database, and the Department of Health will work with your facility, or have your facility lead actually, to identify any potential previous and additional cases. That's, again, the retrospective review of medical and laboratory records. You will not be allowed to have any new admissions. You will not be allowed to be moving your residents or patients till the investigation is complete. Facility testing, or they'll ask you to have high awareness for pneumonia with any of the other your residents, and certainly order testing for Legionella, specific testing. It starts off with the UAT test, a urinary antigen test, which is very specific, but unfortunately it's just for one species and one serogroup. That's Legionella pneumophilus serogroup 1, although that's the major species and serogroup causing disease. A negative UAT test does not mean the person does not have Legionnaire's disease. It just means they don't have it caused by Legionella pneumophilus serogroup 1. So you would need to have other what so-called your lower respiratory secretions cultured, and or other testing run on it. Gosh, here's another acronym, folks, NAAT. But this is an important one because it's increasingly being utilized by departments of health and by us in the industry. So that's nucleic acid amplification testing, a fancy word for PCR. The polymerase chain reaction, you probably heard it also, qPCR. This is where this is molecular testing. This is the DNA fingerprinting that is on the horizon. They've had drawbacks in the past because of certain inabilities of the test, but they're being worked through now, and techniques are making the PCR test, or this nucleic acid amplification testing, very appropriate for detecting and managing Legionella. So Your environmental investigation has these requirements. You're going to have to do a lot. You're going to have to submit an environmental sampling plan. Typically, they're now going to require 1 liter samples and maybe a lot of swab sampling. They're going to recommend that this should be done by a third-party consultant. And ultimately, they're going to make recommendations for remediation of the possible environmental sources. And this may be the remediation of your potable building water system. That's a large undertaking. But if subsequent sampling does not show that Legionella is under control, that's going to be a next step, is to do a sanitization, we call it remediation, and that's really quite a task. The sampling plan, a typical one, is going to include way more than just a couple samples. The Department of Health is going to want you to test the incoming water supply from your municipality or otherwise. They're going to want that representative sampling, as I mentioned, and spaced out. You get proximal, medial, and distal outlets per water system. You want to make sure, if you're multiple stories, a larger facility, that you're sampling different risers in the plumbing distribution system. A minimum of 2 samples per floor and wings. And as far as the case patient, that room is going to be thoroughly tested. Every outlet in that room, primarily, you're going to have sink and showers, or it could be independent living, two bedroom literally, or a larger facility with a kitchenette and everything else. So you're going to test all those outlets, any devices such as humidifiers or CPAP machines, as well as any facility care areas where this patient, may have spent time. Maybe there are not showers in their room at your facility. You have common showers. Then you're going to want to be testing those. All hot water tanks, storage tanks, and boilers producing the hot water for your potable water system, and their recirculation loops returns back will want to test. They will want tested for Legionella. They're looking for all the sources, trying to make a determination on the extent of colonization, and that's ultimately going to dictate, are we going to just simply be able to flush this out of here, or are we going to need to do some higher level of remediation? What is key, though, is that you communicate and consult with that DOH. They're there to help. Don't look at them as the police department. I'm not being down on the police department, but they're not there to rescue. They're there to investigate, and let's find out and stop any exposure of Legionella, to residents. So remediation of the building water system is going to be very probable. If you found Legionella, in some cases, the Department of Health, even if your first round of testing comes back, you met all the other criteria, you've decided to sample a representative number of samples, and they come back all non-detect, they're going to remind you that that's just a snapshot in time. That does not assure us that Legionella isn't there, hiding in the biofilm, and could be subsequently released and pose an exposure hazard. So that's why you're not going to just get by with doing 1 round of testing. You're going to do a lot of testing, both after remediation or before you do the remediation. The follow-up sampling is going to be, in some cases, every 2 weeks for 3 months, and then monthly for 3 more months. That's 9 sets of tests. And, you have to be prepared for this. You have to realize that this is going to be an endeavor. It's going to be a financial endeavor, but it's all, again, for the public health. The goal of that sampling, unfortunately, at this point, when there's a confirmed case that you're dealing with, certainly an outbreak, they're going to want to see all non-detectables in the testing. and doing things during that time. Your water restrictions are going to be in place. We haven't mentioned the use of point of use filters, but these are special filters, medical grade filters that can filter down to 0.2 microns that have been approved, that could be put onto a shower, could be put in line for an ice machine, could be used on a sink, and that would effectively trap the Legionella. They're not cheap, and you don't want to use them, as short a period of time as possible. But they could allow you then to use certain outlets if you decide to put filters on, let's say, half of your common showers, and they could then be used during this investigation time. Well, we mentioned the other aspects of case investigation, the no new admissions, and the heightened look on all of that. So, Jack, do you have a question?
I do, yeah. I want to focus on the role of previous test results. Will the Department of Health ask for any documentation on any validation testing you've been doing? Will they ask for a water management plan? What
Yes.
kind of information will they ask for at that building?
Yeah, absolutely. I don't know if that's coming up later, but as I said, it's very important that you communicate with the DOH. If they're not asking you questions, you need to ask them questions. Number one, you're asking for help, but at the same time, they're the ones that's going to direct, what needs to be done. They're going to want to know if you have a water management plan, and I'm afraid the period of time where you can say, well, not yet, it's just about over. That mandate from CMS came out in 2017. It's now 2021. So it's been out there that these healthcare facilities are to have a water management plan. So if you don't have one, that's going to be maybe one of the first things that your consultant helps you with. But if you have one, the DOH is going to want to see that water management plan. And if that water management plan includes sampling, which is not mandated by ASHRAE 188, but most healthcare facilities will use testing to validate their water management plan or the effective control of Legionella. They're going to want to have that sample plan to evaluate it. If your sample plan is, well, we do one test every year, that's not going to be adequate. They're going to want to see a little more robust sampling plan to consider all the devices, the relative size of the facility, and the immediately ordered sampling is going to be that representative sampling. That rule of thumb of 10% of all the outlets need to be sampled to evaluate the level of Legionella. So the bottom line here, you need to be ready to act when the results come back from sampling. It's just time important. The DOH, when they see, and as I mentioned earlier, in some cases, even when they don't see, they're probably going to want to have the potable building water system remediated. And so this goes back to working with a consultant, a subject matter expert consultant on Legionella, and you'll make your decisions on the findings from the assessments and the sampling, and the epidemiological findings is the fancy term that's used in the medical field for the investigation that ensues. So these remediations I keep talking about, or mitigating Legionella, hyperchlorination. The CDC no longer recommends heat and flush. This is kind of outlined in that new toolkit that I just mentioned back earlier, the 2021 toolkit. It's not that heat and flush can't rid a building of Legionella, at least for a long period of time. It's just very difficult to do at the level that is required to accomplish that. Most facilities can't maintain for 30 minutes at every outlet temperatures that approach 170 degrees. They may not have the capability, they just can't do it. It's labor intensive, it's not without risk, scald risk, etc. But the CDC no longer recommends heat and flush as an effective way of remediating Legionella from a building water system. So we're back to the other major type of remediation, and that's hyperchlorination. It means just what it says. You're coming in with high levels of chlorine. And it's not a simple process. During that period of time, anywhere from 6 hours to 12 hours or more, if it's a huge facility, you're not going to have use of the water, of the building water, because it's going to be charged up with high levels of chemicals that could not be used or consumed. You're going to have signage everywhere. There is a toilet everywhere. There is a sink, a shower, any water usage, and that is to say, don't use the water. Maintenance is occurring, remediation, whatever you call it. You're going to get other considerations. Our facilities, unfortunately, many of them are old and have been many times renovated. So plumbing repairs may well be in order to take care of these dead legs that can exist, cross connections, and the balance of your water system. Do you have low flow or no flow areas? All of these are associated with being a favorable environment for not just Legionella, but bacteria in general. This is where the bacteria and Legionella get a chance to make home, form a biofilm. And that's where they live, and that's where they can proliferate and grow to levels to cause a health hazard. So these plumbing repairs can be extensive. A lot of the facilities we look at, bedpan washers in every room that are in disarray, have been just cut off. They're not working, they're corroded. Same with the showers. This person just never takes a shower, so that shower is never used. And so a lot to consider here on the plumbing side. You'll be draining and sanitizing devices such as ice machines and hot water tanks. And then there may be ultimately a discussion about long-term supplemental disinfection treatment. This is where you will have to put in place a supplemental chlorine or some other chemistry like chlorine dioxide or monochloramine system to provide your water system with disinfection if you cannot get Legionella under control by these other remediation and your water management plan. So communication and PR, it's so important. This is a very sensitive time. No one likes the publicity associated with having a case at their facility. So you need to have a plan and have a strategy. And we always, want to emphasize, have a communication team to possibly address the media and have a consistent message. Your consultant and firm you're working with many times can help you in this respect. Key is being transparent with the employees, with the residents and the family members. And a very effective way of doing this is consider having a town hall to just, I'm here, we'll answer questions till there are no more questions and hear your concerns. Because there's a lot of myths, a lot of things associated with hearing that word, Legionnaire's disease. That's why I try and say, hey, it's pneumonia. It's bacterial pneumonia. It's serious, but it's not some obscure wild thing out there that has the tab Legionnaire's disease. So touch base with that Department of Health frequently and involve your consultant. And that's going to wrap up just the formal part of the presentation and hopefully open us up to a robust Q&A. So Jack, do you have more questions? Or
I do. I have one more question. I think that was a very good summary of the kind of how the process is initiated with a case investigation, to the clinical requirements, to the kind of facilities management, plant operations side. With a lot of times they're tasked with the sampling and arranging and working with us, and then as to what to expect when those results come back, and then how to communicate that out. And it really is a group effort, as we were discussing. But with all that, what is the number one recommendation or maybe even sort of mistake that people might make through this that we could help to educate people on it. I know I'm putting you on the spot with this. I didn't prepare you with this, but if there, is there something that stands out where people kind of get off task, or is there, a common mistake or something that we see that you would just say, hey guys, remember to think about this or that?
I think it starts, Jack, hopefully with having this presentation and background information on exactly what Legionella is, and the disease that it can cause, the pneumonia, and that it's a waterborne pathogen, that it can be controlled, and it is serious. Many times we see these things simply passed off to our maintenance person, and that maintenance person is always overwhelmed already with what he or she has to do with that facility, their quote regular job, and now they're told, oh yeah, we have to have a water management plan and you're going to be responsible for that. No, it does take a team. The water management plan, one of the first things that you do is you form a team, and you better have infection control involved. You better have administration involved. You better have someone who's got the, who can make judgment and okay expenditures, because you may have to start doing some things that are going to cost some money to get squared away. Testing for one. So, Jack, it's a great question. Every time we have these discussions and we talk about, well, what do we do? What are we trying to do? And I've always heard this, you rattle off. We want to keep the hot water hot. We want to keep the cold water cold. We want to keep the water moving, flowing through the building, not sitting stagnant in low flow or no flow zones. We want to have disinfectant in that water, and we want to have the systems, clean, as clean as possible. All of those factors are the root causes of getting bacteria, including Legionella, into our potable water system. The Legionella is a very heat tolerant bacteria, and unfortunately, our healthcare facilities, are over here very concerned with scalding. And in some cases, here's where we get into a lot of weeds, but there are plumbing codes that are different in every state and locality that maybe have to be met. And so you can't have the so-called recommended temperatures that ASHRAE points out, the CDC points out. Produce and store your water at 140 degrees Fahrenheit. Distribute it at no less than 120 degrees, preferably 122. And these things become overwhelming. So if you can't do those things, that puts more emphasis on some other strategy or part of the water management plan to effectively control Legionella. That keeping it moving and flowing is very important. The CDC talks a great deal about, don't leave it out of sight, out of mind, that unoccupied room or that wing that's under renovation or that infrequently used outlet. Have a flushing plan. So I think that's the biggest thing I see, Jack, is it can be overwhelming, certainly for one person, but it needs to be a team effort at our facilities, starting from the top.
Absolutely. Thank you.
Let's start with some of the biggest hitting questions. This one came in repeatedly. Jack, Bill, does chlorine in our city water help reduce the risk of Legionella?
Yeah, I'll take that one. Yes, we hope, but guess what? Didn't mention this in the presentation, but the Department of Health, in an investigation, and even before an investigation, part of your water management plan is your facility should have conversation with your municipal water supplier. It could go something as simple as, we're a healthcare facility. We have a vulnerable population, to certain waterborne pathogens. And so it's critical that, we like to get background information profile on our water. So we'd like to do chlorine testing. That's an excellent idea. You should have a profile. One of the first things that the DOH in their investigation will know, do you know about your disinfectant level in your water coming in? Don't assume just because you're getting water from the city, Yes, they do chlorinate it, or it may be a chloramine system. It doesn't matter. It's still going to be total chlorine you're testing for. But hey, you might be on the end of the line. They're required to send it out the door with measurable, free, available chlorine. They target certain levels. But by the time it gets to you, it may be very low. And when it comes into your building, it doesn't get to your furthest distal outlet without possibly being consumed. So it is important to have some background information, what we call a disinfectant profile on your building water system, because it can start there. They can do certain things. They can come in and do flushing downstream of water hydrants to bring fresh water into that area that should have higher levels. So yes, do not ignore the disinfectant level of your incoming water and just assume, oh, it's from the city, so it's good. It may not be. We're seeing, we're seeing a lot of changes in that area. I know in the state of Illinois and Michigan, some others, where they're now recommending that the facility not just have a measurable level, which was defined at 0.2 parts per million to 0.5, but to set a half of a part per million, 0.5 as the minimum. That's what needs to go out. Others have even brought that up to close to 1 part per million. So it's a very hot topic.
Excellent information here. Okay, so for this next one, I actually think I'm going to introduce Amber Hegemann here. She is our marketing manager and program developer for our building management department here at Direct Supply. This one came in by, 4 or 5 different people throughout the day. Would this be in our TELS building services available as preventative maintenance?
Yeah, absolutely. There is opportunity to activate your water management efforts in a variety of ways within TELS. We can upload your plan to TELS and then assign members to that plan. Additionally, we'll put out annual reminders to make sure we're reviewing and updating any changes that happen. Testing tasks can be uploaded to the specific areas and the frequency that your plan actually dictates. And then also that helps trigger shipping and procedures for the testing kits that get sent out from IWC. So great options there. And then lastly, the test results actually get automatically uploaded for you up into TELS, and it will trigger any additional tasks based on those results. So a lot of great opportunities to get and integrate your plan and your watering efforts into TELS. And so I would just encourage you to talk to your TELS account manager to get more details.
Excellent. Okay, so this next one, pretty relevant for our time right now. If someone is symptomatic with Legionella today, due to the commonality with COVID symptoms, what specific signs should we be looking at to determine what we're facing?
Excellent question. And we've actually done a presentation that says the COVID world and the Legionella world have collided. And so I'm no doctor, but kind of medically speaking, both COVID-19 and Legionella pneumonia, they're both lung infections. They're both pneumonias. One is viral pneumonia, the COVID virus, SARS virus, and Legionella, bacterial pneumonia. So a lot of the symptoms are very similar, depending on what stage the symptoms they have when they first present at a facility. But yes, we've been looking at COVID during this whole pandemic, and don't ignore other types of pneumonias. We still should, with any suspicion, because the symptoms can be the same. You're going to have fever, high fever, myalgia, and shortness of breath, and that should not just trigger a COVID look at. We see co-infections a great deal, that the COVID positive person also has Legionella. So a great question. Ultimately, they both can be diagnosed, but no one should preclude the other because the symptoms initially are very similar. The the ultimate, COVID conditions. Once that virus does get to the lungs and causes infection, then you'll get the similar X-rays that a pneumonia. The Legionella pneumonia gets to a lung infection much quicker than a COVID-19 viral infection, which usually starts nasal or in your breathing contact even. So yes, certainly be aware of both.
Great to know. So this next one, if I have a wing or a hull that's currently shut down or under construction, how often would you recommend that I run the water down to that area to keep the water flowing?
Jack, do you want to do that one, or?
I'll defer to you.
Okay. I'm just trying to keep you.
No, absolutely. Hey, you're the water pathogen expert here. So.
Another great question, and let me lead off by saying that construction in general, be it new construction or renovations, are highly associated with getting Legionella into the water system. I mean, there are just some sad stories in the state of Ohio, a brand new, $125 million cancer wing and all was opened up, and within the first month they had 10 cases of Legionnaire's disease, Legionella pneumonia. So you want to keep the water flowing and moving in that wing while it's under construction. The CDC recommends that you should have as much usage out of that outlet as if it were occupied. So we always recommend a minimum of 2 to 3 times a week, flushing all fixtures and outlets that aren't being used so they don't become, infrequently used. Try and simulate the activity that they would be if that wing was occupied and not undergoing renovation. There's reason really to even be more robust than that, because if the renovation involves any type of disruption in the water supply or the plumbing, that's an opportunity for again bacteria to come in. So I like to say, I know it's a burden. Again, it's a burden on maintenance, and that's why our facilities need to understand the importance of having the team help address our water management plan activities, so it doesn't just become a reactive plan. It's supposed to be proactive and prevention.
How quickly does Legionella multiply, grow, or spread?
That's the microbiologist question, and I have some microbiology in my background, but I am not a microbiologist. But Legionella bacteria is a very interesting bacteria. I've already given some background on it. It's fastidious. When it's given proper conditions, it can certainly amplify and grow, but it's slow growing. And unless it's released from biofilm and from what we call some other organisms, protozoans, amoeba, that actually host Legionella within them, and sometimes it gets to a point where the Legionella causes the host to lyse, and then it releases a lot more Legionella out there. But just starting with a low level of Legionella, it takes time. One of the reasons why we're trying to get a better handle on testing or get results quicker is that the traditional culture test takes anywhere from 7 to 10 days or more to get Legionella to grow on the medium in the lab environment. So the key thing is finding it, having a regular testing program, whatever it may be, quarterly or whatever the water management plan calls for, and hopefully catching it. But what we sometimes happens though, we have these events, and events from the municipal water supply are not uncommon. Water main breaks, pressure differentials, and they can release a lot of biofilm that's in that plumbing, and it can come into your facility, and literally overnight you've got a colonization on your hands.
This next one, the WMP toolkit mentions to verify that WMP is working as it should. What kinds of things should we be considering without sampling and testing all the time?
I better be able to answer this one. I was chair of that committee during a certain tenure of that 10 years. But very important. I'm glad they brought up the word verification and validation. And believe me, people on the committee even struggled with getting those two straight. I always like to make it real simple. Verification is evidence you can produce that you are doing what you said you were going to do. If the water management plan says you're going to test the incoming chlorine 3 times a week, show me that you're testing it 3 times a week. So are you doing what you said you're going to do? Now, guess what? Is it working? Is it effective? You may have a water management plan that you're implementing perfectly, but it's not a good plan. So that's the validation part. That's where testing is the most direct and consistent way to do that. ASHRAE 188 does not mandate testing. It leaves it up to the facility or the team, to make that decision, because a bank building may not do testing, or maybe do it once a year, but a healthcare facility, they're just two completely different scenarios there. So I'm kind of glad they left it that way, but it is proactive. How do you get around complying with ASHRAE 188 by not testing? You simply say your water management plan that we're following is per the data, per the prevailing technical evidence out in this subject matter, and we haven't had any cases. So you're basically saying we're following proven scientific methodology in managing all of our systems, and we are looking for cases, and we haven't had any, so it must be working. That's a passive way of doing it. So I hope I answered that question, because I think it's an important one. But the verification is, hey, are you doing everything you said you're going to do? Now, I don't want to get into an attorney soapbox thing here, but there's always that little attorney in the background. One of the worst things you can do is have a water management plan sitting on top of your shelf and not putting it in place. You have just raised the level of negligence you are showing. I had an attorney tell me, he said, it would be better off if you just didn't have one, and pleaded ignorance of, I didn't know I should have one, versus having one and not putting it in action, implementing it.
Good information. So this next one came through by a few people. How do we find out who our consultant is for testing? I've asked my superiors and they don't seem to know.
Yeah, so I mean, there's a variety. First is contacting TELS, and especially if you're on the TELS platform, there's one built in right there in the TELS Building Services Network. And with us, we're a nationwide organization, so we're able to service the entire United States. If there's an opportunity in Hawaii, I know a couple of people on our team that would love to go out there and do some risk assessments at buildings out there. But yeah, Bill being at the top of the list. But a Google search can pull that up as well. Getting referrals, recommendations in the area, and your organization might not have a Legionella consultant right now, and it's a good time to have that conversation. Ask infection control, ask the facility administrator, executive director, what that looks like, and have somebody that is there to assist you.
Awesome. Okay, so next up, what is the correct way to collect the water test from my cooling water? Is it incoming water or discharging water?
I'm a little bit
Probably cooling tower.
He said cooling tower. I mean, he said
Yeah.
cooling water. Does he mean cooling tower?
Likely so.
Okay. Yeah, let's address that. So a cooling tower is a device. It's not your potable building water. It may be supplied by your building water, but it goes through a backflow preventer, then becomes non-potable. So this makes it easy. A cooling tower is a standalone device, as we pointed out in our presentation. It is associated with causing Legionella pneumonia in outbreaks. And so you're going to want to test it. You're going to take a sample. And so you're going to get it from usually the basin. So that's where you'd like to get it. You don't want to get the water, coming in, the fresh water coming in. In fact, if you're collecting from the basin, get away from the makeup water that's bringing fresh water in. So you want to get a representative sample of that system. So the what they call the cold well, the basin of the cooling tower, you just want to be careful that you're not scooping up a lot of sediment and other debris that could bias the test. Try and get nothing but the water. Anytime you sample for Legionella, be it your building water, an ice machine, or a cooling tower, you always leave a little ½ to an inch at the top. Screw it on. Don't fill it right to the top and then close it off. And hopefully, I got one other thing. Hopefully that they're getting this done by a laboratory, and that laboratory will be a great source of information. They will give you the test sample bottles and supplies and procedures for taking the sample, because it's important that that bottle have what's known as sodium thiosulfate in there, which will neutralize chlorine. So don't just decide to go do a sample yourself and send it off to the lab. Start with the lab, say, hey, I want to sample my cooling tower. Can you give me instructions and direction? And they will gladly do so.
And also, typically, your water treater might pull a sample when they're out doing their maintenance as well, right? That's oftentimes that's involved in the scope of work. You have somebody coming out there to treat that system, and so they will, as part of their scope of service, at least our standard scope, we pull Legionella samples.
Important. Okay, good to know. This next one I thought was kind of interesting. So every air handler contains condensate in a dark, wet environment where Legionella can clearly grow and be introduced into the air. Should we be talking about how air handlers can contribute, if not cause, exposure?
That's a great question. It kind of brings up my water treater background. So air handler condensate is pure water, right? It's, by definition, it's condensate. So it's not going to be a source, and it's also, now if it's going to sit there stagnant, possibly, and with an opportunity to have other water, mixed with it, so to say, that's one thing. But usually air handlers that have condensate pans will have some little biocide buckets, little chlorine buckets that would help out. But remember, having a source of water, that cooling tower water is not going to cause you disease or Legionella pneumonia until it's aerosolized. So typically air handler condensate is not being aerosolized. It's just being collected in the pan. So it's not at all a high exposure risk. Good question though.
Excellent clarification. So this next one says, is our water management plan created by our internal company, a larger corporation, or by our community?
I like to always say you need to own your water management plan. Yeah, you can get a cookie cutter, plan out there, or from somebody else, but it's your plan. You're the one. ASHRAE 188 really points out the onus is on the facility owner, so to say, people. You may have a consultant, you may have other people on the team, but you're ultimately responsible. So please be active in that water management plan development. There are templates that are now out on the web. A lot of the departments of health, one in particular, Georgia Department of Health, has an excellent template for a water management plan. So yes, if you're brand new to the subject, you've got a bit of a learning curve, but I think we've been dealing with Legionella long enough that people would be able to follow a template and collect their information. If not, then you have to fall back on a consultant.
Question for you, Bill. In terms of DOH investigations, kind of the topic for today, do you see them accepting some of those homemade ones and in the ones that they've tried to do themselves, or those frequently you have to go back and do it? I'm just wondering the level of accuracy if a community is trying to put it together themselves and what you've seen in your experience.
Yeah, Jack, you know, we've seen everything from something written almost on a napkin to something that is, you know, 100 pages long. So a lot of people took the Legionella toolkit, the original 2016, 2017, because it was titled, you know, how to, you know, helping you do a water management plan. So it had questions, you know, that's the heart of the ASHRAE standard. You know, is your, do you have, you know, people being treated, you know, sick, overnight stays? Is your building over 10 stories? It goes on and on. Do you have a cooling tower on site? Do you have a hot tub? So you're answering yes, no to all of those. I've seen some people think that that's the water management plan, but there's no corrective actions there. So the departments of health, I mentioned this earlier in the presentation, they really vary. And I know you know this too, throughout the nation. I mean, we have some, you know, that won't even ask for a water management plan. They'll either say, you know, hey, you know, you've got this case and we recommend you get a consultant, and then follow their directions. Then we have some that want to not only see your water management plan, but they will pick it apart. Mm-hmm. So yeah, it's all over the map. I wish I could give you something specific.
Yeah.
But
no, we've seen that in Ohio, right? Where they really
yes,
get into the nitty gritty, and there's, yeah, so definitely.
So this next one is kind of specific, and I'm curious if this is even answerable for us. This facility's public water utility collects a sample from their facility weekly to test the chlorine levels. What should that facility be looking at for levels versus what the city is actually testing for?
Okay, good question. You know, the municipality is following the EPA Safe Drinking Water Act, and there's a quality of water that they have to pass. We know they take care of crazy things called Giardia and Cryptosporidium and fecal coliform, you know, that they test for those, but they don't test for Legionella. So all we can fall back on is the level of disinfectant that they are providing. And I applaud that. And that's a perfect example of have communication with your supplier. They're coming out there on a weekly basis. They might have a great relationship. The person said, hey, we're a healthcare facility. We have a vulnerable population. Well, we can come out there and we'll check for chlorine, but it should be, I hate to say this, as high as possible, but I would not like to have it less than a half of a part per million, 0.5 parts per million or milligrams per liter. What can they do about it? If it's not that, like I said, are you on the end of the line? They have some things they can do, but you'll just have to solicit their help. But yeah, you want to have as high a free available chlorine level, not one that's already been chewed up on its way to your facility.
Awesome. Okay, so this next one, let me grab it here. Okay, would a chlorine dioxide system help to keep our facility's water safe? What about a building water treatment like a water softener? Does that help my building?
I'm gonna hang on there.
Bill loves this topic.
Well, you're right up my alley here. First of all, a water softener is not going to help in the sense of it's a disinfectant. But what it will do, if you're in those areas of the U.S., I think some are up in your area, Jack, where there's a lot of hardness in the water. That hardness ends up being scale and deposits in your heat transfer systems, your hot water system. And that then becomes kind of a substrate or a base for bacteria to form or biofilm. So it's not a disinfectant, but water softener is a good thing if you have really high hardness. Now, chlorine dioxide, now we're talking about that supplemental disinfection. In other words, the facility themselves is doing something about the disinfectant in their water. And so chlorine comes, usually is right there. Then the others get fancier. Chlorine dioxide, monochloramine, copper silver ionization. These are all secondary disinfection protocols. They all have their pros and their cons, but I assume this facility, if they're using chlorine dioxide, probably have it supplied by, they didn't just decide to go out and get it on their own. So I would want to refer back to that company, their water treater or their consultant that has recommended chlorine dioxide, but chlorine dioxide can effectively be used if the people using it are well experienced in it. You're not going to do well with chlorine dioxide and feeding it directly like into the hot water system, because it's going. So you'll want to really treat the cold water system and maybe supplementally the hot water system. I'm getting into the weeds of that, but fall back on whomever recommended it. I haven't run into any facility that just on their own decided to go out and get chlorine dioxide.
Mm-hmm.
So this next one, again, it's kind of specific, and I'm curious what the response could be. If I have a 5-story assisted living complex with 138 units and no cases that I know of, where should I begin to start my testing?
Absolutely. So there are, specific testing protocols that you can carry out and very good best practices where, we can start out as a guide. Typically, we like to look at the water entry. We like to look at the water heaters, a distal outlet, a proximal outlet, medial outlet. But this is where you work with your water management consultant, somebody who has some background in this, and they can very easily, with the help of a facility map, plot out those different points. But really the hot water system is the biggest offender within the building. So you want to start out by testing that in a hot water recirculating line as well. But, you can take 2 samples. If you're going to take 2 samples, it's the water entry or the water heater and the furthest outlet from that. It all depends on your budget and your appetite for testing to really dive into it. But we typically recommend pulling an initial sampling of 10 samples that follow the initial protocol that I laid out there. So you would start by contacting TELS, really.
Yeah.
They,
so smart.
Yeah.
Yes. So this next one asked, should my facility be waiting for a case to show up before I test my water management plan?
No. So we call that the canary in the coal mine scenario, where you really want to proactively test your facility in order to avoid a case investigation. As Bill discussed, it is an incredibly painful, intensive, stressful process. They always happen at odd hours. It's not a great situation. So you want to do whatever you can to avoid that, because you're also talking about, an illness, an infection from a resident in your community. So in addition to the financial burden, the time burden, the process we were laying out takes probably 30 to 60 days just for that initial investigation. And then it's ongoing for probably another 12 months in the event of a remediation. So you really want to do everything you can to prevent any sort of case, which in order to prevent a case, you need to know if your system has Legionella in it. The only way to do that is to test.
Fascinating. This is such great information. Thank you, Jack.
Absolutely.
Okay. So this next one gets a little bit deeper into something. If we have a UV sterilization system installed in our building's water entry point, and we have a chlorine shock run through our system, does that kill every existing and prevent all future possible exposure to Legionella?
So I would love for Bill to weigh in on this when he has the time, but just kind of my opinion on it. The UV system coming in will kill it. It'll hit it at a point in time. And so there might be opportunities down the line in the system where Legionella can grow. So you have dead legs, you've got outlets that are little used. You might have materials of construction, the type of piping, corrosion in the pipes that allow for this biofilm to grow. So there might be an opportunity down the line. Now, chlorine is effective to a certain point, and really there's no silver bullet out there. So it is kind of using all these levers to come up with the right protocol that exists in there. And if it's working, and Bill might have some more pros and cons of, you know, the constant chlorination, but you know, there are some, you know, you would want to validate and make sure that chlorine is getting to every single outlet in the building. And so what we see is sometimes when you're pumping it in, it does dissipate throughout the course of the system. So it's very hard to get it to every single outlet. And that's why, as part of a water management plan, you do want to test for chlorine in your system every so often. So you know, it's an interesting approach. So I would love to have Bill weigh in specifically on the application.
Great. So this next one, and you'll have to excuse me, I said 8 questions in the beginning, but we've had about 8 more show up. So
okay, no problem.
Just
hey, I
stop
feel like
me
I'm in a
whenever you
post-game
need
press
to.
conference. Yeah, no, I'm good.
Okay, perfect. So this question came in that asks, listen, I don't have any cases of Legionella. I don't have any concern about Legionella. How often should I be testing in my facility for Legionella?
Yeah, so we hear that from everyone that's ever had a case. And you don't expect it, right? Like, but the reality of the scenario is that about 50% of buildings test positive for Legionella. And every time you test for it, it's a snapshot in time. So the CDC toolkit recommends quarterly. We recommend semi-annually. We know budgets aren't infinite here, right? So, you know, quarterly to semi-annually, 5 to 10 test kits per testing cycle will just keep you to the validation point of that water management plan, and just having that reassurance that you are controlling Legionella. There's water main breaks all the time that happen in the United States, and so that's another way to introduce Legionella into your system. You don't know who's doing construction around you. Temperatures are increasing around the country, so there's a lot of different factors that are changing all the time, and your water system's aging, and so you just never know what's going to happen during that. And so it is that routine validation, and it's good. It's good that you haven't had cases, and it's good that you don't have concerns, but it's important to stay vigilant with your water management program.
Very important. Okay, so this next one is a little bit personal. Curious what this looks like. In our particular instance, 1 sample out of 10 tested positive for Legionella, and our testing company recommended deep faucet cleaning. Would you think that that's a sufficient response?
I do. So yeah, and I would again defer to Bill, and Brian Pickett's our other expert that we have on staff that really dives into this, and they get involved in a lot of these. But based on my experience and what I've seen is that yeah, deep faucet cleaning, flushing, retesting that outlet just to see what's happening within that faucet that's a good protocol.
Thank you. So during a case investigation, when we do think that there is a case in the facility, can me and my staff pull these samples, or do we need to outsource each sampling?
You absolutely can pull them yourselves. You just want to make sure you're following the CDC's testing protocol. And when we work with clients to do this case investigation testing, we'll ask, you know, is this something you feel like you're competent, or you have staff that has the ability to pull samples? It's not overly complex. You just want to make sure you're handling them in the proper way. You're getting the samples returned back in the appropriate amount of time to make sure that they're not out of holding time, because there is a window from which it is pulled to the time that it actually arrives at the lab to be a valid sample. You want to make sure you're not cross-contaminating. You want to wear gloves. You want to do all these things and make sure that you're taking it from the right location, because on paper, we see a lot of times where, you know, the facility map looks great, and then we get in there and you have a water heater that you can't open up. You have, you know, so it's, what do I do if this is the case? So I would say a large percentage of the case investigations we work on, are pulled by the location. Either regional will come in to help with that, or the facility staff will just pull it themselves. But at least with our clients, we provide that education and knowledge so that they're well informed when they're pulling those samples.
Brilliant. Okay, so this one, Jack, you'll have to let me know. I think Bill answered this when we talked about the tower. So this question came through that says, we'd like to know the best way to test our water from an ice machine. Do we collect it from the incoming or discharging water?
So actually, when we test ice machines, you can do it two ways. First is actually taking ice and putting it in the bottle. So what you'll do is if you're trying to take a 250 milliliter regular validation sample, what you'll do is you'll get 2 bottles, because melted down, that'll add up to the volume that you want. If you're doing a case investigation, you'll have 2 1-liter bottles that you fill up with ice. So that's one way to do it. You can also get it from the supply that is coming into the ice machine. And sometimes they even have water spigots on the ice machines. I know you guys sell a variety of different ones, but that's really how you would take it from. And we see it a lot. We see ice machines test positive because of the rooms they're put in sometimes aren't specifically built for ice machines. They're put right up against the wall. It creates a lot of heat. And so there's a lot of different factors that go into ice machines. But yeah, it really is kind of doubling up the bottles. So with our customers, we'll send an extra bottle to fill up with ice.
Cool. Excellent. That's really good information. Okay. So, sorry, go ahead.
No, I was going to say, beware of hotels.
Oh, very good.
Yes.
Okay, so this next one is specific to a state. So again, I'm not sure if this is answerable at this time. This attendee would like to confirm that assisted living communities within the state of Ohio are not required to have a water management program as long as you're not part of CMS. Very specific question.
So it is very specific, and I want to give a caveat where this is going off. Let's double check this. We do have some regulatory folks on our staff that will do that, but based on, if you're not CMS or Joint Commission accredited, you are not required to do a water management plan, but it is recommended, we would say.
Sure. And then Amber, I think you are going to be my ask on this one. We had an attendee ask the following. You mentioned TELS once or twice. I don't know what that is, and I've never heard of that. Direct Supply sells me my equipment. What is TELS, and how should I find out more?
Sure. So TELS is a software platform that Direct Supply has that helps you with contracts and preventative maintenance. It helps trigger tasks for your facility to keep up with, and has a lot of great opportunities within itself. So I would recommend talking to your account rep, and then they can get you connected to a TELS sales rep that can talk more about that. It works better from a corporate level so that you have multiple facilities within. So that's one of the options that you would want to discuss as well.
Now, for anyone interested in learning how Direct Supply can help you navigate these technologies and products, please help me welcome back Amber, our marketing manager and program developer in building management.
Hello, everyone. As Bill mentioned, Legionella outbreaks are becoming more and more of a concern for senior living facilities. So I'm so glad to see so many of you who took the time to learn about how to handle a positive Legionella case in your facility. So when you think about water management, it can be broken down into 3 categories: plan to prevent, test to confirm, and then react to remove. Here at Direct Supply, we offer products and solutions to all of these. And so I'm just going to walk you through the different sections. For planning, we have 3 options based on your staffing and capabilities. It ranges from self-help practice, best practice task and TELS, to bringing a water expert to your facility to do on-site plan development. I personally recommend the last one, as the insight and knowledge gained on your water system is truly invaluable. As far as water testing, we range from good, better, best options, with each having good benefits based on your specific needs. My choice would be in the middle with our CDC Elite test kits, as these test kits are recognized by the Department of Health and can be easily carried out by you or your employees. Now, everything I've talked about so far with the options of water management plans and testing are all available on directsupply.net. As we continue with the last bucket of removal and today's webinar topic, this is where our program is more focused on a case-by-case basis, and it will need to be vetted out through our whole water team. I think Bill did a great job covering this section today, so I'm not going to go into great detail here, but the main component I want you to take away is that Direct Supply and IWC are here to help through every step of your water management, especially the ugly, tedious investigation and remediation factors of it. Additionally, if you have Direct Supply and IWC included in your water management plan and have testing process through us, we likely can head off any issues before they become monumental to your facility and your residents. That being said, we have a wonderful offer for today's attendees. We put together a Kickstart water management package that includes the initial on-site consultation, 10 water test kits, and a customized training for your employees. This provides everything your facility needs for ASHRAE compliant, all at a discounted rate. A near $5,000 value is now for $4,500. I highly recommend taking advantage of this package if you're currently struggling with staffing or struggling with consistency on your water management control and testing factors. This offer will fulfill the CDC requirement of a water management plan, align you with the recommended frequent testing throughout your facility, and give your employees confidence in your water efforts today. This offer is available until October 31st. As usual, follow up with your Direct Supply representative or email the water management team with questions or concerns about your facility. And we look forward to hearing from you on anything that we can help with. And with that, I'll pass it back to Megan to close us out.
Wonderful. So that wraps up everything that we have for you today. Thank you again so much for joining us, for spending your afternoon here, and for learning about this very important topic. And a special thanks for all of those great questions, and to Bill, Jack, and Amber for your time. Again, if you have questions related to the webinar, please reach out to webinars@directsupply.com. Have a great day, everyone.